Hello, and welcome to Abby Tyler's Healthy Living. My name is Abby Tyler. I'm your host, a family nurse practitioner, a health and wellness blogger, and a community volunteer. In here, we discuss evidence based health information regarding mind, body, and soul with a holistic emphasis. Thanks for joining me on this journey of health and wellness. Please enjoy the show. Hello, hello, hello. Welcome. Happy Tuesday to all of you. Welcome to our Tuesday show. My name is Abby. I am your Healthy Living NP. Welcome to our Tuesday show again. Please share the show. Please share the show. As you can see, today's topic is erectile dysfunctions, is also known as ED, and is also known as impotence. So please share the show and put my glasses back on here. I'm just going to get to my manners. Yeah. And so please share the show. And also, I'm trying to raise money to put more back into because it's all evidence-based information. So, but if you cannot, support me by sending stars, please at least share the show because it could be relevant to you or somebody that you love. Okay, and always my disclaimer, I'm a provider, but I'm not your provider, so please do not make any changes to your regimen with us checking with your own provider. Okay, so we're going to be talking about erectile dysfunction. Alrighty, I got the idea to do this show because, by the way, happy to hi to all of you who are joining me on YouTube, Abby Tyler's How to Live in page, the group, and also Focus on Liberia and everywhere else. Please share the show. Okay, so I got the idea to do this show because it was a pastor that was on, and he was talking about addictions and all that. So he said erectile dysfunction, and one of the main reasons behind it was because of masturbation. So, and I also did a show that says can religion and medical science coexist. So it's not saying that this person's wrong or that person's wrong and all that too, but sometimes they can coexist, but then sometimes they don't exist. All right. They don't coexist, not because one is wrong and one is right. It's just because sometimes you have to go after evidence-based stuff. Alrighty. So and I did counter him. I said, there are many reasons why people have erectile dysfunction too. And he's like, okay, what is psychological study saying? Masturbation is the reason why erectile dysfunction exists. So anyways, I disagree with him. But again, like I say, if I'm talking to my patients, I'm not going to be just saying that. So okay, so please share the show and let's get to it already. Did my disclaimer already. So you might say, okay, so what exactly is erectile dysfunction? Let me just get my notes together here. So, by the way, erectile dysfunction is not, I know some people like don't like to talk about it that much because it's like, it's an intimate thing and it's something that most men deal with already. So, let me go in here and I can just get my stuff together. So, don't forget, you know. So, go here. So erectile dysfunction, let me just go straight to the definition here. Erectile dysfunction is the inability to achieve and maintain an erection. Oh, quick disclaimer, please. This show is all about, it's an adult show. So if your discretion is advised. So if you have other younger kids around, you don't want them listening or something sensitive that you don't want other people hearing, you might want to put your headphones on, okay? It's a couple show is for everybody too, but it's just, very discretion is advised. Alrighty, so inability to achieve or maintain an erection that lasts long enough for a man to have satisfying intercourse or orgasm. Occasional bouts of ED, erectile dysfunction, are common. 43% of men in the United States experience erectile dysfunction from time to time. While it's okay, every once in a while, because there are many reasons why you get it, but if it happens over a period of time, then of course that's when it becomes a problem. Alrighty. So, study from Cleveland Clinic demonstrated that erectile dysfunction is increasingly prevalent with age. Approximately 40% of men are affected by at age 40, and nearly 70% of men are affected by age 70. Okay, alrighty. So, you can leave your questions and comments over there, and I'm going to be responding to them as we go along. Alrighty. And if this stuff is not recording, I'll just make a video and then put it back up later. Anyways, okay, so signs and symptoms already. So what I mean, signs and symptoms, because when I usually talk to my patients, I ask them, difficulty getting erection, the inability to get a firm enough erection to have sex, all right, and you desire it, or difficulty keeping erection. So I usually ask, are you having the problems getting staying erected or getting erected? So those are two major things. Some people can have one, or some people can have both. Okay, so that's one of the questions women ask you when you come there. So, having that, and you in a relationship with your partner, and that could be they can have a problem because you're in a relationship, you want to have intimacy with your partner. So some of the complications of that can lead to unfulfilled sex life. Again, people always talk like, he may go outside, or she may go outside because I don't feel like I'm satisfying her. Loss of intimacy with your partner, again, a strained relationship with your partner, because that can have some issues there already. And depression, anxiety, low self-esteem, because as a man you want to be able to do that with your. So you let me go in here for a second. So what is erectile dysfunction? I did that already. And inability to have a get a female partner pregnant, because if you would have, I'm not saying female partner, because they're the ones that get pregnant. So if you cannot get an erection or maintain an erection, it's kind of hard for you to be able to stay in place enough to be able to get her pregnant. Alrighty. So let's go to the causes of erectile dysfunction. So again, like I say, erectile dysfunction is also called ED, and also so when you see ED on there, that's what erectile ED or impotence. Alrighty. Okay, so then say, some of the complex people, like it's very complex. All right, the Urological Society, erectile dysfunction is a result of complex interplay between vascular, neurologic, hormonal, and psychological factors. Alrighty, so let's what talk some of the causes of erectile dysfunction. Alrighty. So one of them, aging. Sometimes it's just natural, that comes along with aging. Okay. As you get older, like I talked about before, as you get older, things kind of slow down. Your ability for the heart to be able to send blood to all down to your lower part of your body, and all that slows down over time. And also as you get older, things like cholesterol and other things, and other medications and everything, that can also affect the circulation, because it's mostly a circulation issue. Okay. So as you get older, your body doesn't move your blood doesn't move as fast as you were when you were much younger. So of course that can happen. Doesn't mean that is inevitable. It just means that some age is one of the risk factors of that. All right. Some medications can also affect that. Medications like if you went for chemotherapy, you taking in medication, any kind of medications and treatments, radiation that you had involved in the pelvic area as a man. Let's say if you had like prostate issues or prostate cancer, and they had to do some radiation to that area. There was this famous politician. He ran for president, Bob Dole. Okay, he had erectile dysfunction from his chemotherapy because he had prostate issues. So he went to his he had a mean commercial with his company that was also had a drug that was taking care of that. So you can look him up. His name is Bob Dole. I think he passed away a couple of years ago. All right, some high blood pressure medications too. I'm not going to call different medications on here because I don't want people saying, oh my goodness, I have to stop taking that medication, because why would it give me the medication that's going to affect that? Okay, so talk to your doctor about that and see which medication works for you, and it can go on from there. Again, when you go see your doctor, your primary care provider, or your urologist and all, they're going to be asking you for all these different symptoms and all your different your medical history and all that. So it's important that you tell them that, so when they're prescribing medications for you, they can say, okay, maybe this is not going to work. Because people might say, oh my goodness, your heart is hurting you, or you got something going on your heart, or you had this and all this. The only thing you worry about, you only worry about sex. It's a major function of somebody's life. Okay, so don't shame people into thinking that, yes, because my heart doesn't work or this doesn't work, doesn't mean I want to be able to be intimate with my partner. It may not be a major concern in your relationship. It may be a major concern in other people's relationship, but that's a major part of life, and we have to deal with that as providers. All right. Hormonal treatment for prostate cancer too, like I said. This is not all inclusive too, so I may leave some things. I'm just bringing out the major ones. Okay. Medication that you use for hair growth too. They also kind of work with the prostate, but it's also secondary uses is for hair growth. So they will tell you, I'm going to be giving this medication to you to kind of help with your baldness, but at the same time that may also affect your ability to perform. So you can decide, do I want to have my hair, or do I want to do that? It doesn't always happen that way, but that's one of the side effects of it too. Okay, and also some cholesterol medicine too. I talked about cholesterol the last time, so think about that and talk to your doctor about that, because again, people might say, I don't want to use that because I don't want that happening to me. Okay, so also stress and anxiety. when you're stressed, if you go into a major thing, major life event, or you're depressed and all that too, the last thing you want to do is like, so you're not, your brain is not functioning right. So it's not going to be, you like your brain sending message to your heart saying, okay, hurry up, we need to get this blood and everything out of the way because we need to get that done. And you're just sitting there and you're depressed or you're anxious about something, you're not going to be in the mood. So it's important that, communication, again, like I talk about relationships, communication, communication, communication. And also when you go in to go see your doctor and all that too, we'll be treating underlying symptoms. So if you're saying, me and my wife and you were going through this and all, we're going to be asking you all those things today because again, we don't just look at the illness, we look at all of it in order to come down to our diagnosis and also treatments. Okay. And also injury. If you ever had any injury to that area when you're younger, kids are running around, they're running around and stuff and they're hitting themselves over there over time, that can also have a problem because it could be like, well, actually, did you ever injure yourself during that time? Different kind of sports and all that too. Sometimes somebody get kicked you right in there and that could cause a problem too. So those are some of the reasons. And some diseases, especially again, like I talk about diabetes and high blood pressure, heart disease. I talked about that. I pounded that in so wrong reference. Anyway, so I said that over and over and over again. Okay, take care of if you have high blood pressure, take care of your high blood pressure. If you tell you have cholesterol, I talk about atherosclerosis. If you smoke and all that too, all those things that can affect the circulation that goes down there. Okay, so if your heart is not working okay, it's not going to be able to pump the blood effectively down to your lower part in order for you to be able to get an erection or maintain an erection. So it's very important that if your blood pressure is high, your cholesterol is high. If you missed the show that I did on high blood pressure and cholesterol, is just look on a couple of videos over here. You can see that, and please make sure you take care of that because that's important. All right, that's important. And sometimes when you have erectile dysfunction, there are certain medications that we cannot give you based on that too, but there are other treatments out there too. Okay, so please be careful of that and keep an eye on that. Alrighty, so and talked about other concerns would be like low testosterone. That's usually the hormones that kind of control your libido and also your ability to when you start getting into manhood and all. So if that's low and if you're having erectile dysfunction at a very young age, then that's when we know that maybe there's something going on there. You have to go see the urologist and also endocrinologist, and they can do some more blood work and all. But first, you be seeing your primary care doctor, and they can do other things too. Okay, so but especially when you're young, you should be having that when you're young because when you're young, you're virile, and you can do all of that. So, but if you're having those problems when you're young in your 20s and all, that's very important. Please bring it to your doctor's attention. Sometimes low back pain, so especially I did show on low back pain. If you're having severe low back pain and you start having problems, like you go in on yourself, number one and number two, but when you start saying, okay, I'm even having a problem having an erection, ding, 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 that's a big sign you want to get to the emergency room as quickly as possible because that can show this an injury, the major nerve injury that's going on there that could cause major problem. It could cause you from like not walking, become paralyzed and all. So you want to get that checked right away. I send patients like directly to the emergency room if they ever told me that. All right. Alrighty, and if you have kidney problems and all, that can also affect that. And sleep apnea, I talked about sleep apnea, because you're not getting enough blood that's supposed to be going to your major organs because you're sleeping and your mouth's wide open and the blood circulation is blocked everywhere. So that's important. Lifestyle, alcohol, drugs, and all that too. That can also affect that, and also riding your bike. I know a lot of people who are bicyclists. Is that what they call? Yeah, that's also important because remember the seat is like resting right in between the area that where it's like your between your penis and your scrotum, and also then when it's resting there, it's resting also your prostate because it's resting with your prostate. Because if you have any issues with your prostate and all, that can affect that. They're saying mostly like more than 24 hours a week, but some people who are like avid bicyclists, they usually ride longer than that. So I'm sure you're following up with your doctor too, okay? Making sure say, am I having any kind of injury? Am I causing anything that's going to be happening that's going to cause me a problem later on? I think what was the cyclist name? I think Lance Bass. I think that's the guy from InSync. He was this big, I think was Olympian and all. And at one time he got into trouble and he had testicular cancer or something, or prostate or something like that. So it's important that you get all that, you get that checked. I think you can wear a protective lining to where it's not just pressing right up against that. So it's very important that you talk to your doctor about that. Most of the time, people who do sports medicine, any kind of sports, heavy sports that you could cause injury to that area, it's important to talk to them about it. Okay. So So that's some of the causes, like I said, more than that, if you have like you're paralyzed and all that, Parkinson's and different things that can also affect your ability to be able to perform. Doesn't necessarily mean that it's going to take away all of that, but that's one of the risk factors and makes it more difficult. And sometimes again, when you're in your relationship with your partner and having some difficulties getting them pregnant, or just the fact that you're not being able to perform the way you're supposed to perform, that can cause problem in the relationship too. So right? So I'm going to go in here and I'm just going to take a little break and then I will be right back. Leave your questions and comments and I will get to them during the show and also after the show too. If you have not liked and followed Abby Tyler's Healthy Living page, please do so. So give me a break. We'll take a 1 minute break and we'll be right back. Okay. Welcome back. Welcome back. Today's title is Erectile Dysfunction. We're talking about the causes, the treatments, diagnosis, and coping methods. Please hit the like button. Please invite others. Again, viewer discretion is advised. Okay, and I'm going to put my banners back on here. And please leave your questions and comments. Let me see here. Oh, thank you. Let me see what I can hear for a second. Eugene just said Lens Armstrong. Yes, thank you. I was thinking, what did I think? I was like Lens Bass. I'm like, that's the guy from NSYNC. Yes, I watched NSYNC also. Thank you, Eugene. Yeah, thank you very much. Alrighty, so go back here. Okay, so again, so we're gonna go in here and now we're gonna be talking about diagnosis. Okay. I think I left the diagnosis here, and okay, I didn't make a banner for that. But anyways, let's talk about diagnosis. Alrighty, so most of the time in primary care, because again, like I said, you're going to be going to go see your primary care provider before they send you to go see a urologist. If your situation is a little bit more complicated, complex, and all that too, we will send you to see a urologist because sometimes it just needs medication, and sometimes again, like I said, talking about different things. So for a diagnosis is you come to see us and we talk about it, and most of the times it's it can be a little embarrassing because people don't want to tell people that yes, I'm coming in to to see about that, and you can make up any excuse. You can make up any excuse once you get into there. You can say, yeah, my don't say my your chest pain, because then we're going to tell you go to the emergency room. But you can make up any excuse that I'm coming in to get checked, I want to give me some blood work. And then when you're in the office, you can say, I'm here because of this, and I'm having a problem. I mean, sometimes too, when people walk in, there are times when people walk in and be like, "Oh, you're a woman." I'm like, "Yeah, did you not see the name when you were coming in, or or you're younger, or you're oh my god, maybe somebody that I know and all that too." But don't let that bother you because we are sworn to be, professionals and all that. Again, like I said, I've gone to people who my doctors who I had to sit down and discuss some stuff with them, and they were my coworkers or people that I know very well. So come in. It's a disease that's very prevalent. It's a condition that's very prevalent. So don't feel bad that you have it. Okay. And there's so much help out there. Okay. So when you come in for a diagnosis, we usually just kind of talk about it. The most important thing is I usually will prescribe blood work though, because we want to make sure there's nothing going on with your heart and you don't have diabetes and anything else that may show that. And we'll also do like a PSA level. We'll be checking your prostate too, because we want to rule out anything that's going on with your prostate, especially when it's like prostate cancer or something that shows like your prostate is enlarged. Okay. And we'll do your physical. We'll also do your history, and also ask you about your medical history. We'll ask you about your family history, especially like the men in your family, if they have any prostate issues, if there's any testicular issues, like your testicles are the two one to call colloquially balls. All right. So we check into that, and we can also do your physical examination. And that's the part sometimes people get a little, they're like, what are you gonna do? I'm gonna be, I have to feel to make sure there's nothing going on there in your testicles. And then also, if if you don't mind, I'm gonna my fingers will have I have gloves on, and I have to look in there to make sure that you're not having large prostate. So it can be a little, and people are like, oh no, don't do that. And some of them would be like, yeah, go ahead and do it if that's what you have to do. And most people will say no. I was like, okay, yeah, I can always send you to see the urologist then. And then if you go to the urologist, and the urologist is a woman, same thing. So it's not, there's always over somebody else in the room too, by the way. It's not just me in the room feeling up on you and all that, because you have to make sure that nobody says that you came in the room and did all that to me. So it's very professional. Alrighty. But we'll do do your history and physical, we'll do the blood work. I usually tell patients I'm going to do some blood work first, and I want to see, and especially if you also have diabetes, we want to see if your diabetes is controlled, right? Because we're looking at your A1C. I told you guys about that. If it's like under 7, if you're type 2 diabetic, if you're under 7, that means it's controlled. Okay. If your number is going up and up, and if you're on insulin already, if it's under 9 and staying under 9, that means it's controlled. But we want to get it down to at least 7. So we got to be checking on that, and checking on you make sure you're not anemic, your blood count, and everything else is going, your kidney functioning. We'll do all the blood work, we'll do your cholesterol level, all of that first. If it comes back and other things that we go into, everybody's individual. So after we do all that, we usually will start you on a medication, and then we'll go on from there and say, okay, if there's something else that I've determined that it's a little bit more complex, because we primary care can do so much, and then we have to work within our scope of practice, and then we'll tell you you have to go to the urologist. Most people don't have issues, well, if you like, you had an injury before or something happens, then definitely you have to go see the corresponding a doctor, urologist. Sometimes you may have to see a neurologist, the brain, and you have to see endocrinologist and all that too. And now it can be like, people don't like going to all those different places because it can be a little bit expensive if you have to go to see all these different specialists. But if you have like a serious issues, that an injury or something else is going on, pre-existing issues like the ones I listed before, that can cause problem that you may have to go follow up with them. Okay. But most of the times we start you on the medications. Okay. So let me see, after we do the blood work and all, then we start the treatment. Let me go in here first. So we get to treatments. Alrighty. So the treatment usually will be treating the underlying causes, of course. Like I said, if you have high blood pressure, if you have diabetes and things like that, we want to make sure, we want to do that and be controlling that at the same time that we're giving the medicine. If your blood pressure is really high, also we probably won't be giving you the medication, because we don't want you sitting there and it's all your blood pressure, you need that blood circulating in your body, and all of that, the blood pressure, your blood pressure drops or too high to where you can cause yourself a stroke or something like that. We don't want you doing that while you're being intimate. All right. So we'll probably see you like a couple of visits before we prescribe it. Some doctors will prescribe it right away. I usually like to get the blood work and everything done first. But if you're a patient that I already know, maybe like one more visit just to make sure, if your blood count wasn't recent, I want to get the blood work done first. Alrighty. So most of the medications we do, which all the first one we start is a PDE5, is the one you see on TV, where the Viagra and all the other different stuff. And also we kind of prescribe that. Of course, if you're taking the blood pressure medication, there's certain blood pressure medications that we cannot prescribe Viagra and all this other stuff. All right. So we may not do that already. And of course, if you're taking some of these medications, you can eat really heavy because it kind of absorbs the medication. So you can be having like a nice dinner before you become intimate with your partner, whoever and all, but then it may not work because you just ate a really heavy meal. So some of the medication. So when you get the medication, ask the doctor, what can I do and what can I do while taking these medications? And some of the medications can give it to you. You can take it when you need it. Also, you can take it every day, so you'll be ready to go whenever you're ready to go. Also, we tell you got to be careful, because sometimes if you get to a point where you have an erection that's lasting 3 to 4 hours, don't just sit there and be like, oh yeah, I can continue doing this until, no, that means your heart is not working perfectly. Get out of there and get to the emergency room. All right. So they can give you the injection and release that pressure. All right. There's also penile injections too. They can just like ready go in there and just give it to you. Sometimes it's self-injection. There's also suppositories that we can put in there, because it kind of clamp down on the prostate and makes it easier for the blood to flow. There are natural remedies also, like acupuncture and all that, counseling, because again, like I said, there's something that's stress related and there's something behavior related, you want to talk to your psychiatrist or psychologist, and also they can talk to you about it and then see what's going on. So some of the things they can do with that would be your cognitive brain therapy, where they can identify and change your negative thoughts patterns. Because again, like I said, and sometimes if you don't have a good relationship too, like you had issues with your relationship and then the relationship is really bad, you're gonna be like, yeah, I don't get turned on by them, or I don't get turned on by her, I don't get turned on by him. So no, maybe that's why I can't, so that those are things that you're going to have to talk about before already. They have to talk to you about, sex positive, decreasing your sex, and just talking about, of course it's going to be a consensual sex and all, and it'll take away the shame and guilt, because some of us grew up in the culture where it's like sex is only for procreation. So you're doing anything if you love it, if you even think about it, or you think about it outside of anything else. Especially like the culture that we come from is like, no, they make you so ashamed to even think about it, because, and if especially if you're a woman, oh my goodness, that's even worse. All right. So, and also go into masturbation too. They will tell you, you be able to like arouse yourself, because you may need a little help arousing yourself first before getting to that point. You may have to do all that, you play with each other and all of that before you can do it. Don't just, some people can just get to it and some people can't. Again, based on your medical history, based on everything else, we're going to do, when you see the psychiatrist or a psychologist, you can talk about that. Alrighty. So let me see here if there's any questions that I need to ask. Michael, what's up? Good to see you again. Hi, Michael. I You don't understand why you can't see me on Facebook. I'm there. I don't understand it, but nice to see you again and glad. Thanks for watching. Okay, so what are ways to cope on this? Alrighty. So, some of the ways you can cope about that. So, you're talking to your partner. I mean, again, like I said, it can be it's very intimate things, and it can bother you. Okay, because you want to be in a relationship, and sometimes you're there and you can get it up, and then or you're there, and it's like 2 seconds later you're done. And people have made so many songs about this, and especially when you're going through that, and especially if you have a medical issue too. Let's say if you have like a neurological issues where, again, like multiple sclerosis, you had a stroke, stuff like that, that can cause the brain to the channels that sends the message down and all that too is kind of fragmented, so you can get it. And then sometimes, again, like I said, you're stressed out, you're doing too so much, you're going through so much in the relationship, you may not want to get to that point. So there's something that's very important. And communication, again, I can always say communication is very important when you're in a relationship. Sometimes some people don't believe in that, but it's very important. It goes a long way. And especially again from other cultures where you don't think that you need to talk to a psychiatrist or a psychologist or something like that. And it can be a little expensive. I understand that too. So you can also just talk to your primary care provider about that. All right. And then talk about, but they have more specialized training, so they can talk to you more about that. All right. So if you can afford it, and there's okay, I think some, I don't know, some religious places. I don't know how you talk to your pastor about that though. Right? I guess, well, if the pastor's trained, most pastors are trained and took all these courses and all that just so they know. And if they're marrying people, all they should be able to like talk to you about it, right? Because after all, it's a major part of a relationship. Okay, so again, the way to cope about it: talk to your partner, find the right time to talk about it. Okay, instead of bringing it up in the bedroom, find a time and place where you both, without distraction and all that. If don't make the person feel vulnerable, and don't just put them on the spot. Don't just call them and say, you know what? No, find a nice place, sit down and talk about it. Don't make assumptions. While it's important to educate yourself about erectile dysfunction, don't try to diagnose yourself. ED can kill two-way conversation and lead to argument if you don't agree. Okay, so don't just go right out there and start talking about that. Don't try to diagnose yourself either. And again, go to your family doctor. We're here, we can listen, we're not going to be judgmental. Okay, focus on your feelings. Discuss how you feel rather than how your partner makes you feel. Acknowledge and discuss your partner's feelings rather than trying to defend yourself. When you're the one that's having a problem, of course you're going to be defensive, because I mean, it's like she's there and it's you. What are you doing? It's you. So let's talk about this. And most men don't want to talk about these things with their wives and all, because you feel powerless. It's like your main thing, your her manhood and all of that. Alrighty, and stay on the topic. Stay on the topic. Now, that's not the time to bring up everything else that's wrong with the relationship and all that too. Remember, you air out your grievances, but don't bring up everything, because when you broaden the conversation, then it's like he's like, I don't want to hear all this. I'm already like feeling bad. Don't make me feel bad that I didn't take out the trash and didn't do this, I didn't do that. Don't just Let's concentrate on that. So you have to, as the woman, you have to be, you know, very understanding. I understand you can be frustrated also, because you be thinking my husband. So sometimes the men won't tell the woman either, because she's like, does he not love me? Does he not value me? Does he not find me desirable? What's going on? And not knowing he's got this problem, but he can bring it up to anybody. He can bring it up to his friends, because it's not something you want to talk about with your friends either. So it's important that you do that. And again, use your healthcare provider. Again, like I said, you both can go together. That's even more important when he makes the appointment. You both can go together and you both can sit there. I've had many times where I had couples and all sitting there talking about different issues and all, and you can sit there and talk about it and say, this is how I'm feeling. How is it making you feel? And you listening to her and then listen to both Peyton, both couples and all that too, and listening to her and him, and then giving them time to express the good thing. Time we want to do that. Make your appointment maybe like right before the doctor goes to lunch, or like right before the last visit of the day, because you don't want to be rushed in. Like, you don't want to be rushed in and saying, okay, I got more patients to go see. I got more. It's like, okay, get time. So when does the doctor go to break with the doctor or provider? When do they go to break? Okay, so let me make my appointment right before that time, so at least that way I know to go into break. They're not gonna be rushing to go into somewhere else. Okay, so it's important that they can have time to sit down and talk with you. All right. Of course, again, sometimes things happen and we definitely have to leave the room. So that's important. Alrighty. So, talk it over and find people who you can confide in, people who respect you, people who understand that, and just understand that this is a condition that is prevalent, meaning that it affects a lot of people. A lot of people don't talk about it. Imagine, and this is just a study that was going to people who volunteered to the study and say, okay, this is what's going on in different and all the different studies from different doctors, different providers over time, when they say, okay, this is the reason. And also the drug companies that see the prescription renewal prescription for that, so compile all this information. But there are a lot of people out there who are like suffering in shame. There are a lot of people who sitting there thinking, must be something wrong with me, or things that I did in my past before that caused this, or maybe I had a stroke, or maybe I got this neurological disease, or maybe because I was playing certain sports, or maybe sometimes I nothing happened, or maybe I was eating too much, I'm overweight, I'm this and that, because you also have to eat healthy too, because anything that causes the heart to work really hard also will slow down your circulation. So that's important that you eat healthy and stay healthy and stop smoking. If you drink, I said stop smoking forever. Stop smoking. If you drink, make it moderate or don't drink at all. So especially if it's causing you that problem. So a lot of people out there who are going through this, and don't think you're the only person going through this. And if you're the female partner out there, partner, wife, girlfriend, whatever, there's help out there. There's so many help out. There's so much help out there. When like I said, you can get the medication, you can get the implants, you can get the injection. There's so much out there that it can do for you. And it's not always just the sex part. There's so many things that you can do besides sex. There's a lot more things that you can do that's intimate, that you can keep you and your partner together. But if that's an important part of when that's bothering you, talk to your doctor about it, because a lot of people going through this, and you can get the help that you need. Don't let people make you embarrassed. Don't suffer in shame. You don't have to tell the whole world about it. You don't have to tell anybody about it. It can be between you, your partner, your wife, and your doctor. That's it. And again, like I said, we're sworn by by laws that we're not just going to go out there. I have people who like in the community, and that's not my place to go tell them that. I don't even talk about stuff. And this online, I barely even mention anything. So nobody's going to say, oh yeah, maybe she was talking about me. No, 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 no. So don't suffer in shame. There's a lot of good way to have a good time and be intimate with your partner and all that too. And if that's an important thing to you, it's important, because we literally, that's part of like one of the system that we learned about in school. So okay, so don't let anybody make you shame. And if your wife is saying, honey, please go get help, because, and don't look at her and say, I want to para wayo, you see, also that so has been it's just about Liberian people. Anyway, so it's important. Okay, it's important. Alrighty. And if you have something that you need to see the psychiatrist for, the psychologist or psychiatrist. Psychiatrist is the one that prescribes medication. The psychologist is the one that can talk. Psychiatrist will talk to you too, but the psychologist is the one that had the longer conversation. And so talk to somebody. And again, like I said, I don't know if religious people can do that. And I'm sure that most churches have counselors in there, and they go to school. They really go to school, and don't go to those pastors that just go to school for like 3 weeks, and the next thing you know, they're apostles and whatever. So make sure, don't be embarrassed. Do not be embarrassed. Okay. Let me see if there's any other questions out there. Obesity can cause, yes, yes. I think I did say that before I got to your question. Yes, yes, and also, I mean, your girth, when you see your stomach line, your stomach area, like you measure yourself and all that too. The farther your stomach is out there too, all of that girth around your stomach. That's also, for one thing, is like just like really bad fat, because it's a visceral fat, and it's really important that that also increases your risk for high cholesterol, kidney disease, high blood pressure, and all that too. And all those things, erectile dysfunction could be a byproduct of that too. So it's important that things that you can modify, like I always tell you guys, modify the modifiables. Modify the modifiables. You can take care of your blood pressure, you can take care of your diabetes, you can take care of, everything else, stop taking drugs, stop drinking, watch your stress level, watch your depression level, deal with that, manage those things and all that. And I know, yes, I said some medications that you take for depression and anxiety can also affect that. But it can be, you can work with your doctor that it can find the right medication that works for you. Okay, I don't want you, having the best sex life that you have, and then next thing you know, you're depressed. All right, so it's important that we can find a happy medium there. Alrighty, so I don't see any more questions there, and just want to say, and by the way, there's more. If you have any more questions later on, you can send it through the inbox of the forum, or you can also leave it there. I usually go back and read and answer all the questions later on. So don't forget, let's continue the conversation in the comments. But for all of you who are watching, please, I see about 11 people watching right now. I need you to step up that like, or like button there, please, please, please. Don't forget to share the show. Also invite others when you do share it. And also thank you all for watching. For those of you watching me from Focus on Liberia, YouTube, Abby Tyler's Healthy Living page, I say thank you very much. Thank you for all your love and support. I'm here every Tuesday at 7 p.m. for a new and exciting show, and I make shorter videos during the week. So if you're not part of Abby Tyler's Healthy Living page, hit that follow button so that way you can see the shorter videos that I put on during the week. I put on different health topics, or I talk about little things, social issues too. Okay. So thank you all for watching. I really appreciate it. Thank you. Thank you very much. Thank you for all your love and support. You have a beautiful night. Good night. God bless.